Guide for Contracts and Grants. It disturbs me that my titles are falling out of their squares, but whatever. So I plugged in, there's the website, I plugged in telemedicine, it generated a bunch of solicitations. The NIH guide is not smart, so if you put in, I only pulled up a few for telemedicine, then I plugged in mHealth, and I got different ones. So actually I find it best to simply browse through the recent announcements, browse through everything, and see if anything strikes my fancy or seems appropriate. Then the NIH reporter site, ooh, this thing is diabolical. Every grant that's funded by NIH is listed on this website. So that means you can go in there and find out what kind of things are different institutes funding lately, what projects that might be like yours have been funded lately, and that maybe you shouldn't go in and try to reproduce. If your competitor has been funded, and if so, for what? And which of the institutes fund projects like yours, and who are the relevant program people there who might be interested in your work, who you should then call. So here again, I plugged in telemedicine as the search term, and I think gave me 19 listings, so I could only fit in this many. So for each grant, it tells you the grant, and I also specified SBIR, so these are just the SBIRs. There's the grant number, the project title, the principal investigator, who they work for, which institute funded them, how much money they got, and then you can, for each project, look up even more detail about when is their start and stop date, so you can know if, for example, their grant's running out soon, and who their program director is. And now you know that Nina Silverberg, who I happen to know at the Aging Institute, is interested in computerized assessment by remote examiner systems, and she might be interested in related things. Yeah?
Do you look for factors such as the number of employees or your revenue per year, things like that? Or do these factors influence their decision?
They shouldn't. And in fact, in the regular basic research grants world, if you have too much money, that's usually seen as a bad thing, because then you don't really need any more money. I mean, what you need to show is that your company has either a good track record so far or a good chance of success in the future. But at no point do they actually ask you how much. They don't look at your budget. All they can look at is what other grants you have. That's the only information that's available to the reviewers. They can't look in there.
For financial information or something?
No.
So if you were a subcontractor on somebody else's R01 grant, does that get you preferential treatment when they would look at you, or was it an advantage?
I'm sorry.
If you were a subcontractor on an R01 in an academic institute.
And then you went in with your own.
And then you went in with your own idea that was totally
yes,
separate. Yes,
I would say that would be positive.
That would be positive.
Yeah. Okay, so then I went through the NIH guide and I just pulled up funding announcements that are currently active that are in the health technology area, just so you could see the kinds of things that NIH is looking for right now through solicitations. And there was a little wave of these that started about a couple of years ago, where the NIH Institute started getting interested in telemedicine and mHealth, and first it was one institute and then the other Me Too's jumped on, and the wave is still going, so it's actually a good time to look for these specific solicitations.
So are these specific for SBIRs, or are these open to everyone?
Some of these, so our 43, 44, those are SBIRs. This one is an R01, that's an SBIR. Frequently, an institute will release an RFA on a certain topic, and they will do it. They'll have separate announcements for different mechanisms. So there will be an R30, 43 announcement, an R01 announcement, an R21. So you have different routes you can go in. Yeah.
I'm sorry if I missed your response to this question, but I'm curious that what if your project or idea fits, let's say, under two of these solicitations?
Oh, then lucky you. Then you call the program directors in charge of each one. You see which one seems to like you better and be more excited by your ideas. You find out what their set aside is and how many grants they're planning to fund with that solicitation. You cannot, however, submit the same grant to the same solicitation. NIH has a very serious rule about do not submit the same thing under try again and through two doors. Although you can tweak it, and then there's just some more. And what time do we have today? Do I see signs?
10 minutes, yeah.
We have 10 minutes, okay. So, this is the NIH system for those of you who dare to enter. NIH is the extramural program, which is the part of NIH that gives out grants, is divided up into different departments that have different jobs. So the institutes we know about, they're the ones who think about what are the big public health problems and ultimately give out the money, and they're the final decider about who gets paid. Center for Scientific Review is where the study sections are organized, and in fact, unbeknownst to many, CSR has probably far more power in the final funding decision for a grant than even the Institute, because those scientific review officers, NIH staff who run the study sections, they decide who to assign your grant to for review, and by assigning to either people they expect would be excited about your topic or who might not necessarily be so excited about your topic, they can regulate your score, within a wide window. Now, these are officers of the federal government and they have ethics and stuff, so they of course try not to do that kind of thing, but in fact, a lot of stuff happens sort of subconsciously at the application assignment to reviewers step. So your application goes in now electronically to the Division of Receipt and Referral, and they make big decisions about is it a neuroscience grant or is it a cardiology grant, and they send the grants to different sections at Center for Scientific Review, where the grants are then parceled out to the specific study section. Then your grant is reviewed typically by 2 to 4 or 5 reviewers who are the ones who weigh in primarily with comments, but they meet together with, say, 20 other reviewers who also have access to the whole pile of applications and who are free to pipe up at any point. So if you decide to submit a grant, figuring out how to direct it to an appropriate study section and make sure you have the most favorable climate for your review is a very key step. So then the study section scores, they're supposed to score strictly based on scientific merit. Of course, personal factors can come in there too. They give it the priority score, which then serves as a funding recommendation to the institute involved. The institutes then, they typically will pay the highest scoring grants, above the 10th percentile, the 20th percentile, or whatever their pay line is. But many of the institutes have some wiggle room with that, where they can either reach down to pay something that scores lower, or even eliminate or not pay something that has a higher score. And those decisions are made together with the Institute's advisory council, which is a group of the great eminences of the field who gather together with the Institute to pontificate and think about these things. And so then that's where the final decision is made. So your NIH contact people at the Center for Scientific Review is the scientific review officer, the person who runs the study section. And you're free to contact that person before your grant actually gets assigned to ask whether they think their study section is appropriate for your grant. And then it's a good idea, once you've picked a study section, to include a cover letter with the application directing it to the study section you like. And then your person at the Institute, the ultimate decider about your funding, is the program director, And you can call them either before or after the review to ask their advice on what study section to send the grant to, whether they think that your application is appropriate for their institute. The program directors actually attend the reviews often, and so if they like you, they can call you from the site of the review and give you early feedback on what the discussion was. But they're not supposed to actually intervene with the review.
During the review process, might they contact you and ask for clarification, or is that allowed?
No. Once your thing is submitted through the electronic submission system, that's the end of that. You can, if you get a paper published or accepted for publication after you send in your application, you are allowed to send them that information, but that's it. The only case in which you can argue sort of with the review is most of the institutes have some amount of discretionary funds, so they'll pay down to a certain pay line, but then they have some extra money to pay grants that fall into sort of a gray zone. And then the program directors help decide which of those to pay, and then the program director might call you and say, oh, the study section had questions about this, that, and the other. Can you answer that? Have you published anything more? Do you have any new data? So we already talked about this. And then, yeah, call your program director. So some people are like terrified of NIH staff, but they're like people like me, you know, they're just like, most of them are like really nice, nicer than the average academic scientist, I'd say, in terms of being warmer and more of a people person. So give them a call to see if they're interested in your project. And if you're thinking of applying for an RFA or a PA, check and see whether they think your project actually sort of meets the vision of the RFA, or whether you're wasting your time submitting. Preferably call with specific questions. People used to call me or come up to me at Society for Neuroscience meeting just to sort of like, you know, cozy up to me, you know, hi, how's it going? How's your week been? You're like, I'm a busy person, don't pester me. So call with a reason, because if you call just because you want to like buddy up, it is like so blazingly obvious. Okay, so that is all I had to say. I could go on and on about what it takes to write a good grant application, and that is actually what I usually talk about when I give this workshop, and I didn't know how many of you all would actually want to get into the nuts and bolts of that. So if you are planning to submit an application and you want more information, there's my email, and feel free to call. Question?
Okay, so what if you apply for a grant and since you won't hear about it for 9 months, and then you go out and get other funding like angel funding or seed funding or something like that? What happens then?
Well, at the time that they would be thinking, at NIH would be thinking of making the award, they ask you to let them know what other grants you've gotten. But they don't ask you about, you know, did somebody just hand you a check for $1 million? And if they had, there'd be no way for them to know what you ended up doing with that check for $1 million. It's only if you double dip on grants. You have 2 grants that are doing sort of similar things, and you end up having people like on the same budgets that you get into problems with that. So if you get the NIH grant and you also have $1 million you got from somewhere else, just put the $1 million and just do something else with it.
Keep it.
Does that happen a lot? Do you see that happen?
So when I was at NIH, I didn't have that many SBIRs. I dealt mostly with basic research grants, and occasionally people would get 2 grants for the same thing, and we were supposed to closely monitor, is there overlap? And sometimes there was, and most of the time people ended up getting away with it, because basically, basically they just want to get the research done. They don't think people are. It's not like professors are using money to, if they have extra money, they're not taking cruises to the South Pacific with it, right? They're using it to support their labs. So, yeah.
Is there any acknowledgement channel, meaning, let's say, they decide to reject your application, do they come back to you and tell you that it's been rejected because of these reasons?
Yes, I should have said that, that's important. So yes, after your grant is reviewed, you get back a review, a critique from the studies section. So they send you a thing saying, reviewer number 1 said this, that, and the other, you were strong in this area, and they have criteria by which they're supposed to judge the application, which are innovativeness, the strength of the approach, whether it's logical or not, the principal investigator, what their track record and credentials are, the environment, that would be the institution or company you're working for, and there's a fifth that it's not coming to me right now, but so they have specific review criteria. They must address them in the review, and you get back the review saying reviewer 1, reviewer 2, reviewer 3. Now the reviewers are anonymous, but you also get back the roster of the study section that says who the reviewers were. So
Is that okay that if you don't hear anything from them, to reach out to them and ask them what happened?
oh, they automatically,
Because in my experience, I had received nothing on CAPS, so I was.
you submitted a grant, and
Yeah.
are you sure that it got into, so first, when you submit a grant, you should get acknowledgement of receipt, which is now all electronic. Then you get an announcement saying what institute and study section you were assigned to, at which point, if you aren't happy with those, you can intervene. Then they tell you when the review date is going to be. You should get your score back within 48 to 72 hours after the review is done, and you're supposed to get your summary statement back around a month after that.
Yeah, I did it a long time ago, it was all manual at that time, so I
Uh-huh.
had something that store.
Yeah.
Hi.
One more question.
Two questions. First one is, for someone that hasn't written a grant before, is there a good reference site you could recommend? I'm sure there's probably that you could Google, but is there one that stands out?
Help